The role of the nurse leader in quality healthcare, preventing patient falls, Pamela Dozier, Liberty University. Falls continue to be a quality and safety issue in healthcare organizations. According to the Agency for Healthcare Research and Quality, studies have found that falls occur at a rate of 3 to 5 per 1,000 bed days. It is estimated that 700,000 to 1 million hospitalized patients fall each year. Some of the contributing factors that lead to falls are adults 65 years or older, inadequate nurse assessments, call light issues, a lack of adherence to protocols and safety practices, a lack of communication between healthcare professionals and patients, and according to the Joint Commission, a lack of educational and organization culture issues. The Joint Commission Accreditation of Healthcare Organization and Centers for Medicare and Medicaid Services puts a lot of pressure on hospitals seeking accreditation to report core quality measures. Falls represent a significant public health problem that health organizations are trying so hard to manage. Falls remain a significant patient safety issue in the hospital, and approximately 1 million patients experience falls annually. Falls continue to be the number one adverse event, with approximately 3 to 20% of inpatients falling at least one time during their hospital stay, and 30 to 51% of those fall result in injury. Quality is a broad term that encompasses various aspects of nursing care. Various healthcare measures have been identified over the last years as indicators of healthcare quality, according to the American Nurses Association. This author researched fall data quality issues at a Richmond, Virginia hospital, their surgical trauma unit. The quality issues that were identified was insufficient staffing that leads to the inability to provide quality care to patients and lead to falls. Falls caused by a lack of patient hourly bedside rounding. And according to the National Database of Nursing Quality Indicators, which measures and demonstrates the value of nursing and providing quality patient care, there is a need to increase patient satisfaction. Fall and fall-related injuries can be the most direct measure of how well an organization is succeeding in making sure the patient is getting the highest quality of care and safety. At the Richmond, Virginia hospital that this author is currently employed, measured patient falls by calculating the rate of falls by occupied bed days on the unit monthly. Advancing measurement and improvement around falls prevention in the hospital is important, as falls are a nurse-sensitive measure, and nurse plays a valuable role in the compound of patient care. Nursing-sensitive indicators identify structures of care and care processes, both of which in turn influences care outcome. Nurse-sensitive indicators are distinct and specific to nursing and differ from medical indicators of care quality. The Centers of Medicare and Medicaid Services benchmark, the National Database of Nursing Quality Indicators, and Fall Incident Reporters are just a few tools to measure patient falls. Patient falls can be avoided if there is a plan of action in place. At this author's employer in Richmond, Virginia, there is an increased need for more nurses to provide sufficient care for the patients. The current plan of mediation consists of collaboration, communication with healthcare professionals, patients, and families. It had been noted that a monthly fall report meeting has been implemented, and the attendants include the chief nursing officer, nursing directors, nurse managers, the physical therapists, and frontline providers to explore and make changes to the fall prevention agreement that the surgical unit implemented in January 2019. The fall prevention agreement is a document that is introduced at the admission of the patient and family, and this in turn will engage patient and family members to collaborate in effort to decrease falls while they're in the hospital. Other plan of actions is the Morse Fall scoring system that was created by the Joint Commission. This tool can be used by the nurses along with a clinical assessment, and this tool will actually determine if a patient is at risk for falls, and therefore the nurses can plan accordingly. Hourly rounds, bedside rounds, it's much needed to make sure that the patient's needs are being met. Interprofessional bedside rounding is a must. And these are just a few of the plans that have been put into action to prevent patient falls. Fall-related injuries can cause an increase in healthcare costs and also an extended length of stay in the hospital. Because anytime that a patient falls and they injure themselves, they are not able to be released. So therefore, it is added days for their stay. The federal government is now penalizing hospitals for patient injuries. In 2008, the Centers for Medicare and Medicaid Services stopped reimbursing hospitals for costs related to patient falls and to examine whether or not the Centers for Medicaid and Medicaid Services no pay policy would influence organization on fall prevention. Falls among older adults cost the United States healthcare system approximately $34 billion, and that was in 2013 alone. The Joint Commission Report on Quality recommends that leadership commitment in the organizations and a systemic data-driven approach to achieve risk reductions and continuous improvement within specific areas in the healthcare organization and specific populations such as our elderly. Patient safety and quality of care can be compromised if there is a delay in patient care and protocols are not being followed. According to the Joint Commission, they require accredited hospitals to assess patients for fall risk so that measures are put in place to prevent any sentinel events. The National Patient Safety Goal refers to the program that was initiated by the Joint Commission. The primary goal of the program is improving the patient care by helping the accredited organization to address some concerns of specific areas related to safety of the patients. The Joint Commission enhances the effectiveness and efficiency of the National Safety Goal program every year, and the Patient Safety Advisory Group aids them. They meet yearly. It's a panel of experts that is recognized wildly for the safety of patients, which incorporate the clinical engineers, the risk managers, the nurses, and other experts who have experience of addressing the issues related to patient safety. Evidence-based literature suggests that healthcare professionals should create a culture of safety to decrease patient falls. The culture of safety is very critical in healthcare. It is used to describe how the behavior of the staff and the leadership team affect the safety of patients. Current interventions that we have in place to prevent patient safety are the fall risk assessments and the health information technology system. Patient falls continue to be on the rise, so there is a need of new interventions, such as increasing attention to high-risk medications, such as Coumadin, blood pressure medications. To prevent patient fall, we need team collaboration, teamwork. Working together, everyone achieves moves. The Centers for Disease Control has implemented the STEADY program, stopping elderly accidents, deaths, and injuries to assess the falls in our elderly population of 65 and older. Nurse leaders must demonstrate an active leadership role in the healthcare environment and consider factors related to safety, effectiveness, cost, and impact on practice in the planning and delivery of nursing and other services, according to the Nursing Administration scope and standards. Nurse leaders must monitor the nurses to assure that they practice safe, effective care, promote clear communication and collaboration, promote new technology to improve patient safety and identify any barriers, evaluate to assure that nurses are documenting clear, accurately, and effectively, implement clinical patient rounds with the interdisciplinary teams, and ensure that nurses are assessing patient fall risk. Preventive falls is a team approach, and leaders must provide effective communication and awareness. Utilizing a team approach with effective nurse leaders, clinical knowledge, and fall interventions in place will reduce the number of falls in the healthcare organization. Implementing patient interventions specific to a patient population, raise awareness, assessments, and collaboration of care are just a few measures that healthcare professionals can perform to decrease falls. That concludes Pamela Dozier's presentation.